Thank you, Tariq. Good morning, good afternoon, and good evening. This week was a very productive week with all member states agreeing a landmark resolution on COVID-19, and today we held our executive board. In particular, I want to congratulate Dr. Harsh Vardhan, the India's Minister of Health, for his appointment as chair of the executive board. As the world passes 5 million recorded cases of COVID-19, we recognize the importance of building national unity and global solidarity to learn from each other and suppress the virus everywhere. A key part of this week's landmark resolution was that, as well as fighting COVID-19, governments need to also ensure that essential health services are maintained. When health systems are overwhelmed, deaths from outbreaks and from preventable and treatable conditions increase dramatically. Maintaining people's trust in the ability of health systems to provide essential services safety is crucial to ensure people continue to seek care when needed and follow up public health advice. WHO has previously released guidance for maintaining these services during an outbreak. In this context, I would like to thank Novo Nordisk for its donation of insulin and glucagon, which will help to support treatment for people with diabetes in 50 low and middle-income countries. This is the first donation in WHO's history of a medicine for a non-communicable disease and comes at a critical point. People with diabetes are vulnerable to developing severe disease from COVID-19 and struggle with the day-to-day problems of disrupted access to medication, equipment, and health care. Initiatives to secure the supply of essential diabetes medicines are very welcome and reinforce the multiple ways that the private sector can get involved in fostering global solidarity. One of the most essential services that has been disrupted is routine childhood immunization. Today, WHO is publishing new guidance on implementing mass vaccination campaigns in the context of COVID-19. WHO, UNICEF and GAVI, the Vaccine Alliance, and other partners are working to ensure that the pandemic does not reverse decades of progress against vaccine-preventable childhood diseases. Today, I'm pleased to be joined by UNICEF Executive Director Henrietta Fore and Seth Berkley, CEO of GAVI. Since the turn of the century, child mortality has been halved, in large part because of the power of safe and effective vaccination. However, we're here today to collectively reinforce the warning that COVID-19 threatens to undermine life-saving immunization services around the world. This risks putting tens of millions of children in rich and poor countries at risk of killer diseases like difteria, measles, and pneumonia. As the world comes together to develop a safe and effective vaccine for COVID-19, we must not forget the dozens of life-saving vaccines that already exist and must continue to reach children everywhere. Initial analysis suggests the provision of routine immunization services is substantially hindered in at least 68 countries and is likely to affect approximately 80 million children under the age of 1 living in these countries. Any suspension of childhood vaccination services is a major threat to life. WHO is working with governments around the world to ensure supply chains remain open and life-saving health services are reaching all communities. The epidemic of misinformation has also harmed vaccination in recent years, And we call on everyone to do more to prevent rumors and pseudoscience from undermining public health efforts that save millions of lives. In June, the UK government will host the Global Vaccine Summit, and we ask the world leaders to commit to fully funding GAVI for its life-saving work. WHO and UNICEF have been working closely from the start of this outbreak to ensure essential supplies are reaching health workers, patients, and children across the world. I now would like to turn to my sister, Henrietta Fore, to say a few words. Henrietta, you have the floor.
Thank you very much, Tedros. It has been 5 months since COVID started upending the lives of billions of people around the world. And we know for sure that its impact on children will last long and cut deep. We fear that COVID-19 is a health crisis that is quickly turning into a child rights crisis. 3 out of 4 children worldwide, or 1.8 billion children, live in countries with stay-at-home policies. Schools are closed in 153 countries, leaving 1.2 billion students, or 70% of learners, out of school. Last week, using data from Johns Hopkins University, we at UNICEF said that an additional 6,000 children could die every day from preventable causes over the next 6 months, as the pandemic continues to weaken health systems and disrupt routine services. And today, UNICEF and WHO and GAVI are sounding the alarm about the impact that these disruptions are having on vital immunization services around the world. And the figures are staggering. At least 80 million children, as Tedros has said, under the age of 1, are at risk because routine immunization services for young children have been substantially disrupted in 68 countries. Vaccination campaigns which seek to vaccinate large parts of the population in a short period of time have also been badly hit, especially for measles and polio. Measles campaigns have been suspended in 27 countries, and polio vaccination campaigns put on hold in 38 countries. The consequences for children can be deadly. There are many valid reasons why immunization efforts have been impacted. Countries, justifiably, have had to suspend campaigns due to the need to maintain physical distancing. Health centers have been overwhelmed with response efforts. Health workers have been redeployed to treat COVID-19 patients. And parents have been reluctant or unable to go to vaccination sites for fear of exposure to COVID or due to movement restrictions. And there have been the serious disruptions that Tedros has mentioned in supply chains and transport services. UNICEF has had a substantial delay in planned vaccine deliveries due to lockdown measures and resulting in the decline in commercial flights and limited availability of charters. However, we cannot let our fight against one disease come at the expense of long-term progress in our fight against other diseases. We cannot exchange one deadly outbreak for another. We cannot afford to lose decades of health gains that everyone has worked so hard to achieve. We need joint concerted efforts to put vaccinations back on track. And there are many ways we can do this. So first, countries need to intensify their efforts to track unvaccinated children so that the most vulnerable populations are vaccinated as soon as it becomes possible to do so. Second, we need to address the gaps in vaccine delivery. UNICEF is working with offices around the world, freight forwarders, partner organizations to prioritize shipments and arrange charter operations as required. But we need them for the emergency and critical supplies, and thus we've appealed to governments, private sector, airline industry, and others to free up freight space at an affordable cost for humanitarian supplies and life-saving vaccines. And may I give a special thanks to GAVI, who made the US $40 million available to UNICEF to secure vital supplies, including vaccines and personal protective equipment, on behalf of 58 low and lower middle income countries as they respond to the COVID-19 pandemic. And third, we need to look for innovative solutions to keep vaccines going. In some countries, this is already underway. In Uganda, for example, they are ensuring that immunization services continue along with other essential health services, even funding transportation to ensure outreach activities. The Lao People's Democratic Republic is conducting routine immunization in fixed sites with physical distancing measures in place. And in other countries, vaccinations are being delivered in pharmacies, in cars, in supermarkets, while incorporating physical distancing in their delivery. And fourth, vaccines need to be affordable and accessible to those who need them the most. Lastly, we need to make sure that we have the resources to do all of this. And this is a significant undertaking that requires generosity and commitment. We know only too well that when it comes to these diseases, no child is safe until every child is safe. Ahead of the GAVI replenishment conference in June, we also call for the additional funding. It could not be timelier. So with that, shall I hand it over to Seth?
Yes, thank you. Thank you, Henrietta. And I now want to turn to Seth. Please, Seth, you have the floor.
Thank you, Dr. Tedros, for inviting me to be here today and for your strong support for immunization always. And thank you, Henrietta, for that opening statement, for your strong support and all the work that UNICEF is doing for this. This is really alarming data that we're announcing today, putting numbers on the fact that we've been grappling with for months now, that the scale of the impact of COVID-19 is having on global immunization programs is something we haven't seen really in a lifetime. It's interesting because recent modeling from the London School of Hygiene and Tropical Medicine show that if you were to try to avoid getting COVID by stopping routine immunization, for every COVID death prevented, you would have more than 100 deaths from vaccine-preventable diseases, which reminds us how important immunization is. Over the past 2 decades, we've seen incredible progress in ensuring every child everywhere has access to vaccines. Basic vaccine coverage in the world's poorest countries has risen from 59% in 2000 to 81% today, helping to reduce vaccine-preventable diseases by 70% during that time period, and as Henrietta has already said, contributing to a halving of child mortality in these countries. New vaccines that protect against deadly diseases such as pneumonia, diarrhea, and cervical cancer have been rolled out worldwide in record time, while global stockpiles against diseases like cholera, yellow fever, meningitis, and now Ebola keep us all safe from outbreaks. More children in more countries are now protected against more vaccine-preventable diseases than at any point in history. Now this pandemic is threatening to unravel this progress, risking the resurgence of other diseases we thought we had under control and putting the lives of millions of children and their families in danger. Not only that, if we neglect the supply chains and immunization infrastructure that keep these programs running, we also risk harming our ability to roll out the COVID-19 vaccines that represent our best chance of defeating this pandemic when they are ready. So this is the problem we're facing. The solution, however, is absolutely clear. Countries must take every step necessary to keep this routine system going and continue to vaccinate. And we're seeing incredible examples of ingenuity, persistence, and hard work to ensure that this continues. You've already heard some examples from Henrietta. Let me just add a few more. In not only is Laos continuing their outbreaks, but they had a scheduled rollout for HPV vaccine, which was introduced to the country's vaccine program in March, and that's reached more than 70% of the population despite the national lockdown there. In Cote d'Ivoire, a mobile app that was set up for vaccination is helping to drive that demand and be able to track it. In Afghanistan, we're seeing religious leaders helping to spread the message. So supporting all of this work is not only GAVI, but our Vaccine Alliance partners, the two most important who are here with us today, WHO and UNICEF. We are continuing to help fund the vaccines, the cold and supply chains, and the wider health systems needed for routine immunization and keeping primary health care going. GAVI has made up to $200 million available to immediately fund PPE, diagnostics, and other measures that countries needed to tackle the COVID pandemic, working alongside with our other partners, such as the Global Fund. And we stand ready to support the mass vaccine catch-up campaigns that are going to be needed to protect the children missing out on vaccines right now. However, for us and our partners to continue to perform this vital work to maintain immunization programs, to prevent the resurgence of deadly diseases, and to ensure health systems are ready to roll out a COVID-19 vaccine, it is vital that the Alliance receives the resources we need to continue our work over the next 5 years. That is why the Global Vaccine Summit hosted by the UK in 2 weeks' time is a pivotal moment. We're asking for at least $7.4 billion for the next 5-year period, 2021 to 2025. That's enough to vaccinate 300 million additional children, preventing at least another 7 million deaths. We've already received substantial pledges from the UK, the US, Norway, Germany, Canada, Italy, Japan, Saudi Arabia, Spain, and numerous others. For this, we're profoundly grateful. But in 2 weeks' time, we need the rest of the world to come together to meet our target so that children and their families and countries, no matter where they are born, can continue to live healthy, successful lives free from these terrible preventable diseases. So with that, Dr. Tedros, let me turn it back over to you.
Thank you. I thank you, Seth, and again, Henrietta, for joining us today. And I now want to open the floor for questions from journalists around the world. So back to Tariq. Tariq, you have the floor.
Thank you, Dr. Tedros, and thanks to our guests from GAVI and UNICEF, who I understand will stay with us to take any questions. Before we start with questions, just to remind you that you can ask questions in 6 UN languages plus Portuguese. For Hindi language, we don't have a possibility to translate questions, but we have a translation if you, simultaneous interpretation if you click on the settings on your Zoom. So if we are okay from technical side, we will open the floor. And first question is coming from Politico, and we have Ashley Furlong online. Ashley, do you hear us?
Yes, hi. Thanks for taking my question. My question is for Seth and Henrietta. The resolution coming out of the World Health Assembly earlier this week says that member states recognize immunization as a global public good. Now, obviously, this is quite an academic term, and there are debates around exactly what that means. I would like to know from you what you see it to mean, and whether you think it has any concrete implications.
who would like to start? Maybe Henrietta?
Thank you very much. So one of the things that we are trying to say to countries is that be prepared, be innovative, think of vaccines as an investment, that it is smart, that it is strategic, but that it is also an obligation for children. So what we worry about most are the countries that are very poor, and we worry most about the poorest households in every country, and we worry about girls. So as you think about where we need vaccines and how broad it should be, this is our focus and intent and need as a world. Seth, over to you.
So sorry for the delay. It's just we were muted. So, thank you for that question. And I think the important point here is to think about the fact that immunization is not only about protecting the individual, but it's also about creating herd immunity and protecting the rest of society. And that's a critical point, because even if if your child or your family cannot be immunized because they're have an immunosuppressive disease or because the vaccine doesn't take, what protects them is the fact that other people around them are protected. That's why immunization has the characteristics of a global public good, and why in the discussion now as developing COVID-19 vaccines, one of the critical issues there is to think about the role it will play in ending the pandemic. So that's not just the individual protection, but the ability to get rid of infection in surrounding communities, to get rid of reservoirs of infection, et cetera. So to me, that's why we should be thinking about vaccinations as a global public good and not just an individual protection device. And it's something it is a nuance, but it's an important point as we discuss what effects these products can have on the world. Over.
Seth and Henrietta have made some really important points, and I want to just add a couple to those. I think the other thing to recognize around global public health goods, as vaccines are, is that the outbreak pathogens don't recognize borders. And although one country may be able to vaccinate a high proportion of individuals and in fact even induce herd immunity in the country, transmission of pathogens cross borders and mean that we're all at risk when any country is at risk. And as we say, especially for measles, which is one of the most transmissible pathogens, is that measles anywhere is measles everywhere. And when we have measles anywhere, it means every country must continue to immunize and immunize at the rate that it does protect every individual in the community. And so we can't protect from pathogens, from germs crossing our borders. And that's why these vaccines have to be recognized as protecting the whole of the world and the contributions from every country to do that.
Thank you very much for these answers. Now we will go to next question that comes from Jamil Chad from the press corps here in Geneva, who is covering for Brazilian media. Jamil, can you hear us? Jamil? Jamil, are you with us? Can you hear it? Okay, so maybe we'll come back to Jamil. If we can go now to Gunilla One Hall from Swedish press. Gunilla, can you hear us?
Yes, can you hear me?
Yes, please go ahead.
Thank you for taking my question. I wonder in places like Pakistan, where you have polio, and DRC, where you have problem with measles, there is a lot of discussion now, when could we restart the suspended vaccination campaigns? So my question to you is that what needs to be in place in order to restart these vaccination campaigns? How to assure that health workers have enough protective equipment and so forth? Thank you.
Thank you, Gunilla. Kate, would you like maybe to start, and then we will go to guests?
Sure, I'd be happy to address that. We're releasing guidance on how countries can assess and can plan for resuming the campaigns that were paused as a result of the onset of COVID and the opportunity that countries needed to figure out how campaigns could be done in a safe and effective manner. So the guidance is being released, and it really calls on countries and provides recommendations and advice on the various attributes to consider. Certainly the availability of the necessary protective equipment for healthcare workers to protect healthcare workers, but also to assure families and communities that they will also be safe in seeking those services. One of the big issues we've found is that people are reluctant to come for immunization services out of concern for themselves and out of concern, of course, for the healthcare workers. So part of the planning that countries are now able to do is have greater clarity on what protective equipment is needed for immunization services, which is different than what is needed when actually treating patients who have COVID. In addition, we've heard and seen that there are innovations around how campaigns can be conducted. With physical distancing, campaigns can be conducted, and they can be conducted in a safe way. And so countries are able to assess the degree to which there is risk for the vaccine-preventable diseases and weigh that against their readiness and their ability to secure the healthcare workers to conduct the campaigns and to assure that there are the protective equipment for those healthcare workers.
Thank you, Dr. Brand. Maybe Henrietta or Seth would like to add something?
So may I just add that to Kate's very good points, there are some countries that have large populations of unimmunized children. So Nigeria, Ethiopia, Democratic Republic of Congo, Chad, Philippines, Ukraine are some of them. So those would be countries that would want to really think about the planning for how they can restart their campaigns.
And if I can just add to both of the excellent comments, there also is an important role here in technology and innovation. And so, for example, in Pakistan, one of the things we've been working as an alliance is to have better tracking, for example, in urban slums, to be able to figure out how those campaigns are going on, when the hours are, and to use that as a way to track people who are vaccinated. So if you have tools like that available, then you can stagger the times of immunizations. You can also bring people back in at different time points and avoid some of the gathering. So I think this is some of the innovation that's going on. And what's exciting about it, and I think this is potentially the silver lining over the long term, is that we might see better organized situations, better campaigns going on that are not only directed at any one pathogen, but coming together with multiple pathogens and done in a way that is more convenient for particularly women, who obviously are major caregivers in terms of being able to do that at a time that's appropriate. And so these are things that can be done over time, and hopefully as we get back to normalcy, we'll be able to not just go back to where we were, but perhaps go back even better as a set of tools to do this. Over.
Many thanks for these answers. We will try to go back to Jamil, who I understand is now available to move with his question. Jamil?
Thank you. Can you hear me?
Yes.
Yes, fantastic. Thank you, Tarek. Dr. Tedros, a question on Brazil. With over 1,000 deaths in the last 2 days, what do you make of the situation in Brazil, and whether you're negotiating any kind of assistance directly from WHO to Brazil? Thank you.
Which country did I miss? Oh, Brazil. Sorry, I missed the country. Sorry, I heard the question. So many countries. Yeah, the situation in Brazil right now, we have, I think, approaching 300,000 cases. I think just over 290,000 cases of confirmed disease in Brazil, with nearly 19,000 deaths. The majority of the cases are from the Sao Paulo region. But also Rio de Janeiro, Ceará, Amazonas, and Pernambuco are affected. But in terms of attack rates, the highest attack rates are actually in Amazonas. About 490 persons infected per 100,000 population, which is quite a high attack rate. In terms of the response, our colleagues in PAHO are providing direct assistance to the government, to many of the states that are badly affected, including Amazonas. In a sense, South America has become a new epicenter for the disease. We've seen many South American countries with increasing numbers of cases, and clearly there's a concern across many of those countries, but certainly the most affected is Brazil at this point. We also note that the government of Brazil has approved the use of hydroxychloroquine for broader use, but we do point to the fact that our current clinical and systematic reviews carried out by the Pan American Health Organization and the current clinical evidence does not support the widespread use of hydroxychloroquine for the treatment of COVID-19, not until the trials are completed and we have clear results.
I'd also like to point out something that Mike touched upon is the disproportionate risk that we see of vulnerable populations for COVID-19. We're seeing this across a large number of countries. All countries have vulnerable populations, and we are seeing a greater impact in terms of disease severity, poor outcomes in groups that are vulnerable. And a lot of this has to do with underlying conditions in these groups, access to care. It highlights the inequalities that we see in vulnerable groups. And I want to highlight that there are vulnerable groups in every country. And so we need to work even harder to ensure that all people have access to health care, that all people have access to testing, to information, and so that we could prevent as many severe infections and deaths as possible.